But first, as promised, joining me is Dr. Keith Forwith from Advanced ENT Allergy. How are you?
Good.
Good to
thanks
see you.
Thanks for having me here.
Thyroid doctor. I like that. I'm looking at the logo, looking at the brand. Thanks again for being here with us today. We have some very important stuff to talk about. But for the folks at home that aren't familiar kind of with what you do and all the services that you guys provide, could you give us an overview?
So I'm an ENT doctor, but I sort of subspecialize in thyroid and parathyroid surgery. So my main focus is things that go wrong with the thyroid.
Absolutely. But you all as a whole cover the gamut of everything.
Absolutely everything that goes from here to here.
Oh, that's a good one.
Yeah.
Okay. All right. There you go. That's how I'll always remember that now.
Yeah.
Actually, I'm a patient as well. You guys have been great to me as well. So I always like to say that. If you would, let's talk a little bit about some of the different technology with thyroid now and how it's changed over the years and some of the specific things that I guess you master, so to speak.
Yep. So it used to be that if you had, let's say, a nodule in your thyroid and there was a suspicion that maybe there was a thyroid cancer, that your only choice was either to leave it there and hope that it wasn't, or to have a surgery. And the safest way to take a nodule out of the thyroid is actually to take half of the thyroid. We call that a hemithyroidectomy. But if we think of the thyroid as a butterfly, because it's butterfly shaped, the safest way is to take an entire wing of the butterfly, which means you lose half of your thyroid if you have to have surgery.
Now, the technology we're going to talk about today, and make sure I'm saying it right, it's radio frequency. Is it ablation? Oh, look at, there you go.
Exactly.
So explain to me exactly what that is.
So radio frequency ablation is, first of all, non-surgical. So we use a probe and we guide it by an ultrasound. We go into a thyroid nodule and we apply energy, radio frequency energy, to the interior of the nodule. And what that does is it actually causes the cells to be excited to the point where they rub together so quickly that they literally burst, they explode. All right, and then that cell is dead. It doesn't grow anymore, it doesn't do anything anymore. So what we tend to see is that after the treatment, we'll get about a 50 to 80% reduction in a nodule size, and we'll stop its growth. And then probably the best thing about this is, unlike the surgery where it can have an impact on your thyroid hormone levels, this has no impact on your working thyroid. It only harms the tissue that you don't want there, which is the nodule itself. Okay.
And can you use the RFA technology for thyroid cancer as well?
So that's new.
Okay.
This started off just a few years ago. The FDA approved it in 2018.
Okay.
Yeah.
18. Okay.
So I started in 2019. Actually had to go to Brazil to learn how to do this because there really weren't any resources here in the States to learn it. And we've been doing it since then, but it started in South Korea a long time ago, 20 years ago. But when we first started here, it was just large benign nodules. But what we've seen from the South Korean data is it's highly effective for small thyroid cancers. Okay. So in the last couple of years, we've been applying it to thyroid cancers, which aren't too big, not the ones that need surgery, but the ones that maybe you could watch, because there's a big push to maybe watch some small thyroid cancers to see if they're going to act badly or not. Well, this is an alternative to that, where we can actually treat a thyroid nodule that has cancer in it, and not only kill the cancer, but save the thyroid in the process.
Yeah, you talked about exploding it or whatever with the frequency. I guess you can put that to good as well, of course, with fighting cancer. So that's amazing. What is the Scarless thyroid surgery, or is that what it is?
So, well, certainly radiofrequency is a Scarless technique. Right. It's a procedure we do in the office under a little local anesthesia. But then there are some people who may not qualify for that, and so there is an option where we can take part of the thyroid or even all of the thyroid out without leaving a scar at all on the neck. Yeah. So the way that we do that is actually to tunnel down from underneath the lip down through the neck, and then we use laparoscopic instruments like you might have heard about for belly surgery, where they just make tiny little incisions. Well, those incisions are made inside the mouth where they heal up without any scars whatsoever, and there's no external scar, and so there's no evidence when we're finished that you ever had thyroid surgery in the first place. And while certainly that may sound at first blanch like, well, maybe that's just a cosmetic concern, but for some people, they get really great outcomes from scars. They can barely see them. But for others, they can really, what we call hypertrophy or even keloid. So you'll see this more in the black population. You'll see this with people who have fair skin who scar badly, that they can avoid having an unsightly scar right here where we're all looking when we're talking.
Yeah, right, especially the location, as you're saying. So that sounds like an amazing option that, again, did not know. I think we're all learning some things today from Dr. Forwith. What about transoral surgery?
So that is transoral surgery.
That's the name of it?
So the way we get there is through the oral cavity,
so
through
that
under
is the
lip.
Scarless surgery.
Yes, and that is the Scarless option. There are some other Scarless options. Now, I don't do those where they tunnel under from the axilla, from underneath the arm, but those have a few more details that make them a little more complicated and a little less desirable. So the recent thing has been to, if the candidate is appropriate for that, then we can go underneath the lip and leave no trace behind that we were there.
I know you're smart, I can tell, but man, that is just unbelievable, being able to do that, and it sounds like you guys are just making gains, and I love it when I hear the technology is changing. Like you said, just 2018, I think you said it was approved, so this is just always changing. You're having to stay up on it, and we're glad that you're doing it. We're glad you're doing it here in our Kentuckiana community. Online, Save the Thyroid has become like a pretty big thing. Talk about the advantages of saving all or part of your thyroid and kind of what maybe has made this catch on.
So the real reason this has caught on is that when people have to have a thyroid supplement, sometimes it goes well, but sometimes it just goes disastrously. Okay? And we can't tell ahead of time who's who. So about 80% of people have no trouble with thyroid hormone supplements. In fact, Synthroid is the most prescribed drug in the United States. And a lot of those patients do just fine, but we can't tell who's the 10 or 20% that are really going to struggle with not having their thyroid producing hormone 24 hours a day, 7 days a week, moving up and down depending upon needs. So not knowing who those are, maybe it's best if we can try to preserve a working thyroid so that no one has to do blood test all the time and have to have pills that you have to take every single day.
Because can it be replaced by medication?
Absolutely, it can be replaced.
But you're saying just to cover, you'd rather have...
But typically you replace it once a day where your thyroid is working all the time.
Okay, there you go.
And your dose goes up and down depending upon your needs when you have a working thyroid, where the pill is pretty much the same pill day after day.
That makes sense. All right, I like it. You're really educating us today. We really appreciate it. Dr. Forwith, thank you so much for being here. You guys have 6 area locations in Kentucky and Indiana, I believe. Is that correct? We
are scattered about. We're easy to find. We have advanced ENT Allergy.com, and you can find me specifically at thyroid.doctor.
I like that, thyroid.doctor. All right, Dr. Forwith, thank you so much for being here today, and thanks for all the information. We really appreciate it.